Hi, I'm Eric Buxbaum with Advanced Orthopedics and Sports Medicine Institute. I'm an orthopedic surgeon with fellowship training in adult reconstruction, focusing on hip and knee arthroplasty. I specialize in treating degenerative conditions of the hip and knee, including primary, minimally invasive knee replacement surgery, direct anterior hip replacement surgery, as well as revision hip and knee surgery. I also specialize in general orthopedic care and fracture care, as well as advanced periprosthetic fracture care for those patients who have fractures around previously placed orthopedic implants, especially hip and knee replacement parts. Every patient is different, and no two hips or no two knees are alike, so I really try to individualize treatment for each patient. We have a list of conservative treatments that we can offer patients before going to surgery, and I take into account patients' function, age, health, and other factors when we make these treatment decisions. If the decision is to proceed with surgery, I do review all the risks, the benefits, the expected recovery, and everything else to give the patients the most information they can have so that they feel well educated on the procedure that they will be going forward with. One common misconception that I see about joint replacement surgery is that patients come in thinking that they can't get back to the activities that they enjoy. That's just simply not true. I have plenty of patients who return to running, some even playing basketball and tennis after hip and knee replacements. My goal is to get you back to doing all the activities that you want to be doing. And with hip and knee replacement surgery, that is possible.